Well, now to Swaziland, where the country has the world's highest HIV rate, and now the kingdom is battling drug-resistant tuberculosis, the main cause of death among patients with HIV/AIDS. Those who have TB often live in remote homesteads in the Swazi mountains, and getting to a clinic is a major challenge. As Emily Iob reports, a new home injection program holds out new hope for tackling TB.
Mainambuli is still a bit hesitant, but soon she will be the personal nurse for her friend Nosipo Mpama. Mpama has drug-resistant tuberculosis and needs medication injected every day for 6 months. But she can't make the several-kilometer journey to the nearest clinic.
It's difficult to ride the clinic because I'm still weak. I know her as a good RHM woman, and she's confidential with people's problems.
Nambuli was a RHM, or Rural Health Motivator. Now she's being trained to be a Community Treatment Supporter, or CTS, by the non-profit group Doctors Without Borders, known in French as MSF, for Médecins Sans Frontières. For her, it was only natural to help her friend.
When she asked me, I felt I had the skills to help her with the treatment until she gets better.
The MSF program was launched in 2008 with the idea that if the sick can't travel to treatment, then treatment must be brought to them. In mountainous and remote Swaziland, this promises to help save many lives. But first, the Swazi government had to be convinced to allow MSF to run the project, says MSF Dr. Sidumo Gumbo.
Initially, it was a challenge because, even myself, it wasn't going to be easy for me to be treated by someone whom I know is not qualified to do that. But in our case, in our setting, more people have been taught. The benefit they've seen in their support groups, more people are actually getting better.
In Swaziland, MSF has trained about 35 CTS so far and have treated more than 200 patients. It's a good start, but with more than 1,000 cases of drug-resistant TB diagnosed here each year, there is a long way to go. Emily Iob for VOA News, Langano, Swaziland.
And that's our Africa Health Network report for today. Well, for more news, development on health, make sure you visit our website at africahealthnetwork.com. Dimiake, back to you.
Well, thank you so much, Lenore. And always for our audience, please remember to tune in Tuesdays and Thursdays for Lenore's very informative Africa Health Network update right here on In Focus.